You wouldn't mind hitting record? Awesome, thank you. All right. So the first thing that we wanted to start the call with is really a big win and celebration of, it's only been a year since we've really started this movement, and we've already got some exciting news to share. So I'm going to hand the mic over to Francois to share this news.
Thanks, Nicole. Hope everyone can hear me. I've got some background noise, but yeah, so in Arkansas, if you're familiar with our effort, we introduced the bill to cover activity-specific prosthetics, but also we added the shower or bathing prosthetic. So we were happy to say that we were able to, Arkansas Blue Cross Blue Shield submitted for a shower-specific prosthetic, and we got paid for that. So it seems like it's working. But I have a couple sit in for United Healthcare, UMR, so we'll see how those turn out. But as far as Arkansas Blue Cross Blue Shield, it seems that we didn't have any issues with that. We did the pre-approval process and it just went through. So, and it's one thing to get approved, but to get paid, that's the ultimate goal. So yeah, we got that through. So that's our win.
Amazing. That's fantastic, Francois. Thank you for sharing that. And, just as a huge milestone as part of this movement and initiative to have kind of the patient zero or patient number one that has received access to care as a result of this legislation. So Arkansas was the first to go into effect. You guys went in effect almost immediately in July, and then New Mexico and Maine are coming up January 1st, 2024, and then Colorado and Illinois will be going into effect January 1st, 2025. So as we're going through this process, we're going to be learning from you, Francois, as well as creating kind of an implementation team that will develop a toolkit and resources for these other states to make sure that they're able to not only get the word out to individuals across the state that this is now a resource, but that clinicians can be able to take advantage of it. So Francois, we'll love to learn more from you in that process of kind of what it was like for you, and what you needed to have in your chart notes and all of that. So thank you for sharing that big win.
Thank you.
Yeah. Awesome. All right, so the next item on our agenda, we've got two items where assistance is needed from individuals across the states. And for the first one that I'm going to talk about, this is really directed towards core team individuals who are kind of leading the state. So at least maybe having one individual in your state take point on helping with this. But this is in relation to our website. And so on the website, we're going to have state pages for every single state, both states that have enacted legislation, states that are working on legislation for 2024, and other states as well. So I will share just quickly a brief presentation on kind of how the website's shaping up, and then specifically what information we're going to need from you. But from your team, we would love for you guys to chat and then identify one individual or a couple individuals. It's up to you, but really someone who can share this information with us with a due date of November 17th. So I will share my screen here. So as you guys are likely aware, we've been working on developing a website so everybody can move, and it is up and running right now, at least with a landing page. So you can go to soeverybodycanmove.org and you'll be taken to this page here, which is just a landing page right now as we're building out the full website. You can invite people to, and yourself, add your email in here to subscribe, and then follow our Instagram channel here as well. But as I mentioned, we're going to have a page specifically for our state pages. So kind of all 50 states will have the opportunity to have this. There's still a few tweaks that are happening to the page itself, so some of this content will change just slightly, but I will send out kind of a full PDF of what the state page looks like. But I'm going to go through right now kind of each section and then identify the sections where we need information from you all. So as you land on your state page, you'll have kind of your state logo as an example, so everybody can move Colorado, but it could be so everybody can move New Mexico, or so everybody can move Maryland, etc. There'll be a link here, which Sam's going to share in a second, of an advocate intake form that you can share and that individuals can fill out if they want to get involved, and we'll give that information directly to you of who they are, what district they're in, and how they want to be engaged. This button is going to change a little bit, obviously, because there's not just senators, there's representatives as well. But if you have any kind of action alerts going on, that's going to be a button that will allow you to have that. If you have a bill, we'll have more information on this. Most of this we can fill out ourselves, especially if you already have a bill, we can get all that information in there. So we're not really needing your help necessarily for this page. But where we will need your help is helping us to identify who your core team lead advocates are. And these are really 3 to 6 individuals that you want listed as kind of the primary points of contact for your coalition. And so we're going to need their first and last name, job title, affiliations, a headshot, and an email or a contact email for them. If you're a state that has just one coalition email, please let us know that, and we can kind of include that in this contact us button that someone can select. Otherwise, the email for each individual, if that's appropriate for you all, we'll take that. So this is kind of the first one. Then on each page, we're going to dive into a little bit more specifics for that state. This is something that we're going to take on writing ourselves, so we don't really need your help on this. It's going to be very similar state to state, but if you do have any specific statistics that you want shared on your state page that might reflect the fact sheet that you're working on, please let us know and we'll make sure that we include that here. But for the most part, we will be able to take on this page ourselves. The next one that's going to be great to have is basically any advocates living with limb loss or limb difference or mobility impairment in your state. We want to highlight their stories on this page as well. And really the purpose of this page is for you to be able to share this with legislators, with fellow advocates, and with individuals, just to get to know like what it is you're doing in your state, and for them to be able to read the real life stories of people who are, having a lack of access or who have gotten access either through charity or through other means, and what that has done for their life. So for here, you'll see there's kind of a scrolling option, but we're looking for 3 to 5 stories of these advocates and people living with limb loss or limb difference in your state that we can highlight, and basically needing their first and last name, what city they're from, a brief story that kind of highlights their lack of access or what access to orthotic and prosthetic care for physical activity means for them, and kind of keeping it to 55 words max, because we got to get it to fit within the confines of the website. And then any high quality photos of them as well, really showcasing movement or their orthotic and prosthetic in the process of that as well. So that's kind of the second area where we need your information. Additionally, we'd love any photos that from your team this is an example from Colorado after a committee hearing. So we'd love any photos from your team, whether you're at the Capitol or committee hearings. And if you're not to that point yet as a coalition, that's totally fine. You could do what Connecticut is doing and doing kind of a photo shoot with individuals in the community and use some of those on here as well. So additional photos. And then if there's been any news or events that your team has been able to get media coverage or any additional links to that, please send those our way, as we will get those loaded onto the website, and then they will show up here kind of at the bottom of your state page to show any relevant news articles. And then if you, like Colorado, have a list of sign-on organizations that have kind of signed on to your bill, let us know the list of those and in what order you want them put. And I know that for some states, you're going to have some of this information. Not everyone's going to have all of this. So just share what you can, and then we'll go from there and kind of building out the page. And we can always update it as we move forward and as your state gets more information. There might be states that we keep kind of toggled on or off depending on how much information we have at this time. This is just another kind of plug at towards the end of the page, allowing someone to click on the advocate intake form. And then kind of the last part of the page is really just get involved and more information for the rest of the site. So kind of to recap the information that we need, and I'll share this presentation with everyone after the call so that we can get this from you all. But really the 3 to 6 core team members that you guys have that we want to have listed on the site, 3 to 5 stories of advocates living with limb loss or limb difference and their photos, any additional photos of your team or individuals that we can use to kind of add some color and add some just more depth to the page would be fantastic. Any links to news articles, and then any state specific sign-on organizations you guys have. So, and please send that to me by November 17th. Hopefully that's a reasonable date for most people to get that within the next 2 weeks. And again, if your state is one that you'd want to have toggled off at this point, so therefore it's not going to be live on the website, please let me know that as well. So I'm happy to, I'll stop sharing. And then if there's any questions anyone has on that, please let me know.
Nicole, there was just a question in the chat about whether this should be for just states that have introduced a bill or for any state.
Yeah, it can really be for any state. So whether or not you have a bill introduced, we can still put your state page on here. So there might be states that actually are pretty far along in building out their coalition, but don't yet have a bill number. We would definitely want your state included on this. This might be more directed towards states that are gearing up for 2024, but there might be some states that, already have significant progress made. For example, Oregon, I can think of, that could put something like this together, even though they're shooting for 2025. So it's really a state by state decision. So it's really up to you all for what you want. And if you want this as a resource for you. So that's really why we're here. We're providing this as a resource for your state. And if
started to call while I was on the drive because I did not get out of jail as fast as I went to. What is this?
Hopefully that helps answer any questions. Any other questions?
Nicole, I had a question. Curious about the mechanism for if people sign up to be an advocate or to join a state's initiative. How do we as lead advocates get that contact information for those people?
Yeah, absolutely. Sam's going to walk us through that resource, but basically we're going to be able to pull that data from the back end and then share it with you in a kind of an Excel spreadsheet. Awesome. All right, well, we'll keep moving along with the agenda. I'm going to hand the mic over to Shanice with the second item where assistance is needed in relation to the fiscal and social impact report, and specifically an L-code survey that she's leading to help gain additional data for these reports. Shanice, are you on? All right, perhaps Shanice is having trouble getting on. We will go to the next item on the agenda and then come back to Shanice when she makes it on. So I'm going to hand over the mic to Sam to talk about that advocate intake form that we mentioned.
Thanks, Nicole. Yeah, let me see if I can kind of, hey, Joy, would you mind letting me share the screen really quick? I'll pull up our intake.
Be good to go.
Cool. All right, so let me full screen this. But essentially what we've created is a resource that allows potential advocates, people who are interested in the initiative, to provide their information to the So Everybody Can Move partners, which we will then be able to distribute to state teams as needed to make sure that you have everybody that you need to get the.
Oh, sorry, I don't know if it's just me, but Sam, I can't hear you.
No, he's gone.
Yeah, we lost him.
Yeah, it's not just you.
Oh, can y'all not hear me?
Oh, we can hear you now.
Oh, okay. It looks like my internet connection's a little unstable, but what did y'all miss?
I would say start from the beginning.
Okay, sounds good. All right, so this is essentially a, sign up form that potential advocates can fill out to provide their information to core team leaders so that you can, find stories, learn about legislator connections, things of that nature. So essentially, this is created through the Phone to Action platform that we use for action alerts to write letters to legislators. But it's not sending a message to legislators, it's kind of keeping advocate information in one centralized area. So this will be kind of one form with one link, and on the back end, our team will be able to kind of separate out folks by the state that they're in and then provide that to advocates as needed. So if you kind of look at this, it has, some basic contact information, address and zip for finding the actual legislative district that a person is a part of. There's some kind of title, company affiliation, kind of description of yourself. If you or someone is having difficulties or has obtained an activity-specific device. And then also kind of how somebody might be interested. And this will be really helpful for making sure that you can, try to place people in the core team roles that they might be interested in. And then, yeah, legislative advocate relationships are also on here just to make sure that, sometimes it's that little connection that makes a difference when it comes to introducing bills. But essentially, something that's going to be really helpful for this, as opposed to the WUFU form, is that the address allows us to know which legislative district advocates that sign up will be a part of, which will be great if you're looking for, a constituent of, Massachusetts District 6. You'll be able to look through the list of folks from Massachusetts that have signed up and see if there's anybody there that can talk to that legislator, for example. Yeah, so that will be a resource. I can put the link in the chat for everyone so they can kind of see it themselves as well. I just sent it.
All right, awesome. Thank you for that, Sam. I did get a message from Shanice, and unfortunately there's an emergency on campus that she's attending to right now. So she's unable to join us, but I will, in the follow-up message to this, plug a survey that she is helping to lead, specifically asking for L-code information. Basically, we're having a little bit of trouble getting access to data in certain states for kind of the all-payer claims data. And so a way around this would be going directly to clinicians, prosthetists, orthotists in states that can help provide this information. So if you are a prosthetist, orthotist, and or an individual working in a clinic that can help disseminate this survey, we would love your help in answering some of these both orthotic use and prosthetic use scenario questions to provide additional L-code data and kind of information around that. So I will send that out after the call, and I'm sure Shanice will be willing to answer any questions that you guys have directly to her as well. All right, so the next kind of plug, again, we just wanted to plug in terms of our resources that we're offering, in addition to that advocate intake form. Sam, if you're willing to share the toolkit and then also the resource folder, just as kind of a refresher for individuals.
Yeah, sure. I can, I sent a link in the chat to the toolkit itself so that you can kind of peruse that at your leisure, but I can share what we have as well. For those of you who might not be aware, we do have a quite extensive advocacy and lobbying toolkit that allows folks to kind of see a step-by-step process of how to make this initiative happen in your state. I'll kind of find the meat of it, which is this kind of step-by-step process, but this toolkit pretty much has everything you need to get this done in your state. It kind of provides an overview of the initiative, what it is, what we're trying to accomplish, the problem that the initiative is looking to solve. And then, there are basically 6 steps to passing legislation. And then we are hoping to have an implementation toolkit to follow on to this, which will then allow folks in states that have passed bills to make sure that practitioners in the state know about legislation or laws, and that devices can be obtained successfully, just much like Francois was able to do with the showering devices, like he mentioned earlier. Within the toolkit, this is kind of, I sent a link to the actual resource folder, but in the toolkit, if you go here, let me find the link for this one, because there are several links to the resource folder within here. There you go. They're everywhere. But we have a toolkit that is kind of an accompanying article to the or the resource folder is an accompanying article to the toolkit. For each step, there's kind of specific resources that would help you in your journey. We have the intake form on there now, and then several resources to help kind of prepare you to bring this initiative to legislators, and then examples of the letter writing campaigns that we've created through Phone to Action, a few templates for legislative contacts, and then legislative technical assistance, which is kind of to help you when legislators ask those kind of nitty-gritty detailed questions that really dive a little deeper into the policy itself. And so this resource folder is going to be constantly evolving. We'll be adding and updating things as we go through this initiative and learn more about what you all would like from us the most. So this is not kind of a static page. This will be updated periodically with resources that will hopefully be helpful with all of you in your journey.
Awesome. And I'd love to flag on this page, Sam, if you'd scroll up just a little bit. The brand guidelines, the logos, those are, things that individuals have asked for, but just know that you can access those here. And then Sam put together this model legislation deep dive presentation as well. That is absolutely fantastic. So I think it really helps basically, and instead of just opening up the legislation and trying to understand what exactly it does, you can open up this presentation and really go through provision by provision what the bill is intended to do, and exactly the ways that it's impacting access to orthotic and prosthetic care for physical activity. So Sam, thanks for creating that as well. I just wanted to flag those as resources for people if you haven't yet seen those on here.
Absolutely. No, thank you for letting me plug this again. And we'll be updating and letting you know when there's new resources on the page so that you all can have everything you need.
Awesome. And then just want to highlight too with the Phone to Action advocate intake form that's in the chat, if you guys are interested in clicking on that and seeing a little bit more about that. But want to share that was really successful using a form like this for New Mexico. And I think Kyle, you guys had like over 100 individuals who ended up filling out that form, and was really important for building the coalition from scratch, really, going from not really having an organized group to having, an assembly of people of over 100 plus, that then Kyle, you were, sending emails out to everyone. I don't know if you want to share anything additional beyond that, but.
Yeah, it was like, I think there's so many people in our community, whether they are a member of the limb loss and limb difference community, they're part of the O&P industry, but I think there's a lot of individuals that may not be a part of those two spaces that want to become fellow advocates. And I think it's really easy to centralize all of your, all of anyone that's interested into one place. And similar, Angela did this as well, but Angela and I, we did regular emails throughout our legislative process so that people felt they could be a part of it, whether they couldn't be there in person, but they always knew what's happening, what are next steps on how they can get involved, and they knew the process of the bill and where it was in the legislative process. And so Angela also did that as well, but we just kept communicating with the coalition that we built, but it's really effective to send them to one single place.
Absolutely. both of you guys did an amazing job with that. Angela, I don't know if you wanted to share anything additional on that.
I don't have a lot more to add to it other than I do think that like casting a wider net, I think there's a lot of people that want to be involved that don't fit into those two silos. So I really am a big fan of letting more people be involved. Anyway, I think people that don't have lived experiences or aren't directly in the industry still care about these things and are affected in one way or another and want to be supportive. So
Absolutely. I think that was something both of your coalitions did a really great job, is involving social workers and physicians and disability rights groups and, people outside of our typical O&P space, which I think is so important. So awesome. And in addition to that, that phone to action intake form is also used as a way of having kind of phone to action alerts is what they're called, so that your community or your coalition can directly send messages to whether it's committee members or ahead of kind of committee hearing meetings, that sort of thing. So that's something else that Sam and also our partners at the Amputee Coalition with their phone to action tool are going to be able to help with for your states. So as you go into a committee hearing, you'll be able to have this kind of action alert created for you. The last thing I wanted to plug is our fact sheets. We talked about this last time, but if your state is in need of help and support in creating a fact sheet, to please reach out to us. And Maddie McTurnan is our kind of go-to person at AOPA and helping out with that. And we'll share her information as well. All right, so that's kind of the majority of our kind of initiative updates and resources. Now we want to hand the mic over to the rest of the states and hear from you all on how things are going. We're going to start with the states that are working on legislation leading up for 2024. I believe Jim Wilkes messaged me that he's unable to attend from California, but would love to hear from Lindy in Connecticut.
Hi, everybody. So we have a few things going on, getting ready for our February introduction. I attended the New England Academy meeting last week, so I was able to meet with Maggie and Joy, and we were able to kind of spread the word to the New England folks that were in attendance, including a few Connecticut attendees. And then Herb is our big champion at this point. He is Mr. Connected to all the legislators, senators, everything. So he couldn't be here today, but he sent Nicole and I a nice summary of the things he's been working on. So in his tasks, he's met with different legislators. I think he's met with senators, people on the various committees that we're looking to have support from, co-chairs. He was advised to contact the insurance commissioner's office to argue for a broader interpretation of, like we talked about last time, just clarifying that this kind of already exists, right? To provide sport or activity specific devices. So he's in the process of doing that, to maybe just have them issue a bulletin to help people interpret this differently, kind of piggybacking on what we already have for insurance fairness in our state. And we're continuing to recruit people for a photo shoot, probably not by November 17th, but we're working on it. I think we have some existing photos we could certainly put on our state page. And that's about it.
Awesome. Thanks, Lindy, for that. And that is really interesting information. We definitely want to stay in touch with you all on kind of the insurance commissioner angle of whether or not you guys are successful in chatting with them and kind of issuing a bulletin that would expand existing insurance fairness legislation. That's not something that we've seen any other state do. And we'll be taking that to another call that we have later today to kind of share that information that you guys are pursuing that opportunity. And also just want to thank the Connecticut crew and Lindy for the work that you guys did this past summer with meeting with Camp No Limits. That's something I want to plug for other groups as well. Like, we would love to empower all of you guys to have presentations on so everybody can move and kind of get the word out to as many groups as possible. So if there's a group like Camp No Limits or other nonprofits or, related entities or conferences that you'd like to share the work that's being done, we would love for you to be able to do that. So thank you, Lindy, for doing that. A number of the advocates that you recruited at that, I connected with Maggie over in Massachusetts. And so that's, invaluable to have those contacts. Thank you for that. All right, for Florida, I believe we have Natalie attending in kind of the lobbyist update for Florida. Natalie, are you here?
I am, and thank you for having me. Many of you may have met either Caitlin, who was on our team, or my partner, Ron Pierce, at the conference, but I will be taking lead going forward into this legislative session on our appropriation and policy bills with Arlene. And so just quick update, we are just about to kind of in earnest start our legislative process. We will be in session for a special session next week in Tallahassee, along with a committee week. And then we'll have our subsequent committee weeks that'll lead into January when our official 60-day session starts. So we are in that kind of preparatory phase. We are secured in a $5 million appropriation locally. And because we received $2 million last year for Arlene's team. And so we're working with Senator Collins and Representative Alvarez on the appropriation. Senator Collins is going to be one of our most, just strong champions. He himself is an amputee. He was a Green Beret who lost his leg in the line of duty and recertified as a Green Beret after having lost his leg. This guy is as passionate and persistent on these issues as I've ever seen anyone be on any issue. So we're very excited to be working with him on that, but he too will be working with us on the insurance policy bills. That language is being worked through the process for us. We're in bill drafting model right now. Those bills will come out the other end, be filed, and we will start the committee process with them, and we'll be giving updates and reports as they proceed. And again, as a need for a call to action, working our coalition, working through the different agencies, we will be doing that with Arlene and having a strategic plan on how do we get across the finish line with the legislature, but most importantly, how do we also get the support of our governor and get that to fruition. So we're in that works now. So again, thank you for having me today. And between myself and Arlene, we'll continue to keep you updated.
Awesome. Thank you so much, Natalie, for that update. And we'll definitely want to get you connected to Whitney Doyle, who's on this call, and Director of Government Relations at the Amputee Coalition. She's based in Florida as well. So definitely want her working with your team. And that's fantastic that you guys have found a champion with limb loss to lead this. I think we've found in other states as well, having champions that have those direct connections to the disability community. They really go to bat for this and help move it forward. So that's amazing to hear.
And we had a unique situation with him recently. I think amplified it and just kind of was catalyzing was that we actually represent the Florida Aquarium locally, and they have the swim with the shark experience, which he did. Well, you kind of need a different leg if you're going to be swimming with sharks. So it was a really kind of moment where, we had some things collide, and it's easy to tell a story. And he works with kids with disabilities, and his son is a child with disabilities. And it's just all, we don't always get this lucky, but we're very lucky.
Oh, that's amazing. It seems like the stars have aligned on all fronts with that. That's fantastic.
Yes,
Awesome.
we're very grateful.
Awesome. Thanks, Arlene and Natalie as well. All right. Is Eric from Indiana on the call? I don't know if I saw him jump on. I know he's working on kind of coming up with a new plan for Indiana for 2024, given some of the hiccups that they experienced really kind of due to political reasons this past year in Indiana, but are charging forward and kind of rethinking their approach for 2024. All right. Yeah, Maggie.
Just say something about that briefly. I was corresponding with Eric yesterday, and it does look like I emailed this to Sam earlier. It does look like Indiana Medicaid has a plan to update their fee schedule to index to 2023 Medicare rates. So I know when Eric introduced that bill in Indiana, part of it was it started as a Medicaid floor bill, and then so everybody can move was added in. So it looks like the Medicaid piece has been addressed separately. So I imagine that the strategy in Indiana will be, not focused on Medicaid this time and really just driving forward on so everybody can move.
Oh, amazing. That is great to hear, Maggie. Thank you for that update. And I think it definitely shows that even even if you don't get your intended outcome with your kind of original purpose, that there are still positives that happen just from putting ourselves out there and pushing things forward, and trying to find all angles in which something can get done. That's amazing. So I'll hand the mic back to you, Maggie, for an update for Massachusetts.
Sure, yeah. So our bill has been introduced in Massachusetts, H 4096, and it was referred to the Financial Services Committee. And that happened back in September, and our champion said, we're not really sure when a hearing is going to be scheduled. It could be at any point. And so we just heard this week that the hearing is scheduled for November 14th. So we have a team of 5 people set up to testify, myself included. We're also going to include a physician, Dr. Crandell, who works out of Spalding Rehab in Boston, who works with people with limb loss and limb difference every day. And they have a grant program there that actually supplies prostheses and orthoses for physical activity. So he's a really great person to have speaking for this initiative. And then we also have another person with limb loss who was a survivor of the Boston Marathon, who has a running blade as well as a skiing device. We're also looking to get somebody, under 18 and their parent to testify. So we've asked a specific person. We're just waiting to hear back from them. And then we're going to have a orthotist speak as well. So we got a pretty good lineup. They did say, it's an interesting learning process. I know Angela has spoken to this. I'm learning as we go too. So, again, it's like this hurry up and wait. We didn't know when the hearing is going to be scheduled. Now all of a sudden it's scheduled. Now it's like, okay, who's talking and when, and let us know right away, So they also said you can schedule as a panel. So I didn't know if that was a plus or a minus strategically. Do we want everyone in our coalition to testify at once, or better to do it separately? And so I was going back and forth with the legislative champion about that. And it does sound like the panels are usually groups of 3. So we have 5. So I'm still going back and forth with her about how that's going to work. But also we have you all, AOPA and the Amputee Coalition, who are available to testify virtually too. So it might end up being like 2 panels, or maybe we'll just all do it individually. We're in the process of figuring that out. But yeah, it's really exciting. I think we can probably meet that November 17th deadline of getting those photos and that information on the website. And we should have some photos from the 14th at the Capitol building. So excited about that. And yeah, everything's moving in a really good direction. So thank you for all the support.
Amazing, Maggie. That's so great to hear. And, we're all behind you, cheering you on as kind of, really the first of this next cohort for 2024. You guys are jumping the gun right now and doing it still in 2023 based on your schedule. So we're cheering you on. Amazing. All right. So we've got Cheryl for Maryland. I know there's been some updates there.
Hi, yes. So the update I have is very different than it would have been 24 hours ago. But so we had identified a primary sponsor in both the Senate and the House. And we invited everyone to actually come to meet in person, see a prosthetic office, see how these devices are made, meet with the patient advocates in person. The delegate ended up declining because her partner is an amputee. So she is pretty well versed with what we were asking for, but the senator did come, learned a ton, got to see a ton. It was a great visit. However, in emails with her last night, found out that she spoke with the chair of the HGO committee, which would be where this bill would go on the House side. She's going to be chairing the finance committee on the Senate side, which she didn't know she was going to be doing until a few weeks ago. But the long and the short of it is that they've basically agreed that they will not consider introducing the bill until they get the financial impact statement from the Maryland Healthcare Commission. They have requested it, but it will not be happening this session. So we're down, but we're not out yet. The Deputy Secretary for the Department of Disabilities is still planning an on-site visit with the patient advocates for next month. So there is a chance that she could still kind of advocate to push this forward. And the MHCC is part of the executive branch of Maryland, which is what her department is part of as well. So we still could push that forward, else we would be looking at 2025 instead. The other senator who we were considering as the primary sponsor, even though she was not the correct committee, she's actually tomorrow going to be announcing her run for the federal House. So she's no longer going to be at the state level, hopefully. However, she's someone who I think could be a really great advocate for us at the federal level. So looking forward to supporting her run for the seat that opened up in Maryland. So we will see how things work. I think our big focus right now is going to be still reaching out to the Maryland O&P companies, let them know that this is in the works, and ask them to complete the survey for Shanice, so we can at least hopefully have our own PMPM that we can pass along to the senator. So we're down, but we're not out. But I think we're kind of going to be figuring out how to move forward given this recent news.
Absolutely. I mean, it seems like, Shirley, you guys are planning all the right steps. I think talking to the Deputy Secretary and seeing if you can get some pressure from kind of the highest level is a great approach, but also knowing that, you know, if it's unable to happen this year, that there's still a lot of work to be done between now and next year. And I know Colorado, you guys were able to just kind of squeak your bill in without having to do the fiscal report, which I think was pretty rare. But it seems like, I don't know if you want to share anything on that, Angela.
Yeah, I mean, we did do a fiscal report. We just didn't do it the way they wanted. So we had a law that was passed that required, and this was the first year kind of instituting that law, that people had to have this fiscal report, but you had to go through this one agency, and the deadline was on October 1st or something. And we didn't even have a bill we didn't even introduce a bill till November. So we missed the deadline. And we basically argued that, you know, they hadn't even used all of the spots that they had. They will only do, you know, this actuarial company would only do so many for each legislative session. And since this was such a new bill, people didn't know about it. They weren't in. It was like, so it was a little bit of a backdoor. We argued that, you know, we didn't even know, we didn't exist by that deadline. Then we used our sponsor was able to get a scholarship to then pay for the same, you know, numbers to come from the same company that the government was, you know, our state government was using. So we just said, like, we did the same thing. We found this other way to do it. Here are the numbers. And then ultimately in the very end, when we were in committee, one of our sponsors was one of the people who signed the bill that had to do with all this actuarial numbers the year before. So she was able to argue that you're abusing the intent. She was like, I wrote and pushed this bill, and you are abusing the intention of this bill. These people have gotten the numbers you're asking for. They didn't go about it in the route you did, that you wanted them to, but, you know, like, you're missing the point here. So it was very strange. And like you said, we squeaked in, but it's not because it's not that we didn't do a report. We just didn't go about it in the manner that they had. And I think because this was such a new bill, the actuarial report was a new bill, that nobody really knew what was going on. I think everybody was pretty confused.
I think we also, so when we had our primary virtual call with individuals, the woman who was the vice president of government relations for Blue Cross Blue Shield in Maryland, she was a bit of a spitfire, but she has since left. And the woman assuming her role, knowing her background, we suspect that she might be in a little bit over her head. So we think that there might be some stuff kind of going on in the background, because Blue Cross Blue Shield is the biggest voice in Maryland from the private, like from the commercial payers. So yeah, we'll see what happens. We're also going to find out if the governor is hosting, he often will host things at like the governor's house, like banquets. And if there's anything he's hosting that's going to be disability related, our contact is going to help us to get an invite. So we're trying to work a few different angles here, but we're still pushing forward. We just don't exactly know what it looks like just yet.
Awesome. Thanks for that update, Cheryl, and for charging ahead. All right, so we've got Minnesota next, and I believe Terry, you asked me to give a little bit of update from the call that we had with Minnesota Medicaid earlier this week, and then I'll hand the mic over to you if that works for you. So we met with Minnesota Medicaid earlier this week, really because of the relationships that Terry and the team on the ground in Minnesota have built. And this was a call led by Terry and their lobbyist, Sam. I joined to help because I'm a fellow Minnesotan. I grew up in Minnesota and was able to offer my story a little bit and answer some questions. So that's definitely a resource to offer others if you were meeting with not Minnesota, but meeting with Medicaid teams. You know, we'd love to be involved and offer anything that we can. Overall, I felt like the team that we had on the call, there was about 6 or so members of DHS that were on there, were very interested, asked some really great questions. They seemed really supportive of the work. They asked about K levels. They asked about the AAA Study Act that the Amputee Coalition is leading. They asked about kind of utilization rates, and really we're digging into trying to understand this. And really the person leading that call, his name was Diogo Reese, and he's their division director of health improvement and benefit design. So if there is a title similar to that you find at other Medicaid offices, that that might be the person you want to chat with. But he's really in charge of thinking through the benefits and how that is designed, and specifically has a background for the disability population as well. So he was really clued in and asking some great questions. They also asked about some of the work that's happening in New Mexico with New Mexico Medicaid. So we connected with Kyle on that, and we'll get some information from them, but just shows the importance of kind of all working together on this, because it's so interrelated and we can share information across states to one another. I think that was some of the big things there. The other thing we learned from that call was the importance of having language specific to Medicaid included in Minnesota's bill to make sure that it was including all populations within Medicaid. So that is an area that we're still learning a bit from kind of the national level in our model legislation that we haven't really come to a consensus yet on, but we're going to be chatting about that a little bit more today in a later call, and we will definitely keep everyone apprised to kind of the strategy or approach for Medicaid as we move forward, and some guidance on that. So yeah, Terry, want to hand it over to you?
Yes, thank you, Nicole. And that is just a great place to segue. First of all, I just wanted to say hello to everyone. And it is so nice to see so many smiling faces. These calls have been amazing this past year. Nicole's right. Our draft language that we received, last May, in the blink of an eye, we got our bill pushed in the last possible minute of our session. We have a biennium session, a 2-year session here. So we did not put specific language for Minnesota Medicaid because the model language didn't have it. We did also offer them the New Mexico language, which did. So we're a little bit confused as to how it got missed, but lo and behold, we have our first draft item for our first committee hearing. Because Minnesota Medicaid said, we'll go through the process now, assuming that it's there, but you've got to add it in. So for those of you who are working with model legislation, I would highly recommend you make sure you have some state Medicaid language in there. Our bills are currently in the House and the Senate, again, biennium session. We have a lobbyist of 12 years, Sam Walseth, who's been working with us. This is the 4th round, the 4th time Minnesota has gone to its state legislation and requested some movement. 2 out of the 3 prior, we were successful. So Sam, we've got a great track record with Sam, and we feel very, very comfortable, confident. Nicole, Sam, and I were on the call with our Minnesota Medicaid earlier this week. We are grateful to have Nicole on the call. I had just returned from a 2-week out of the country trip, so my head was a little bit here and there. Sam was all on it, and Nicole was really able to respond quickly and articulately to specific questions, and they asked really good questions, the right questions and really good questions. They even asked, does Medicare cover activity devices or bathing? equipment, and of course they don't. It doesn't, and so I think they wanted to make sure we knew that you know, these were not covered benefits. Let's see. We've hopped on this treadmill, and we are running already. Our session is in February, starts February 12th and goes through March 12th. It's about a 5-week session this year. And we've got a lot to do between now and then. So these calls are great. The resources are great. The website is great. We're going to link our Minnesota Society's website. We're going to make sure we've got a link to so everybody can move now that there is one. We'll fill the state pages. What else can I tell you? We have, specifically in Minnesota, we have an insurance commerce process called the 62J review. So it's the fiscal and social impact, yada, yada. It's all the numbers and the analytics that they want. So Minnesota does its own version of that. Also, Minnesota State, the Medicaid program will also have its own fiscal note type process. So just for those of you working it, you know, be prepared that your state may have its own process, despite what Shanice is also working with us and helping us. But that will be separate to what they're going to do on their own. What else can I tell you? Yeah, Toolkit is amazing. Grateful for these sessions, and that's pretty much where we're at. So thank you for the time to share, Nicole, and thank you all for all of your contributions here today. And good luck, Maggie.
Awesome. Thank you so much, Terry. All right. So I don't think I see Senator Sue Prentice on the line, but Maggie, are you interested in giving a brief update for New Hampshire? Because I know you've been working closely with Sue.
Sure, yeah. So our bill is on, you know, it had been introduced in New Hampshire and kind of was put on hold while the state was investigating the cost essentially. And the last I spoke with Sue, she believes that based on the very strong insurance lobby in that state, that we may have to compromise and exclude orthotics from the bill, at least this first time around. I am trying to schedule a call with her next week, hopefully, to kind of go through more of the details about that. You know, she certainly does not want that to be the case and was very disappointed, but just felt like she was being blocked in such a way that that was the only path to success in the immediate future. So that's the latest I have right now. And hopefully by the next call, we'll have some updated information there.
Awesome. Thank you for that, Maggie. And such a great point too, that every state is different and kind of have to approach it depending on the political landscape and also, you know, insurance kind of hand in certain things, but definitely there's opportunities to kind of negotiate or compromise through the process. And ultimately our goal is to get as many people covered as we can. So where we can compromise in one state and get at least something across, it's better to do something than nothing. So thank you for the update on that. All right. I don't know, Steve from New Jersey, is Steve on? I don't know if I saw Steve. We will skip down to Kaylee in Ohio.
We have kind of a less exciting update this time. Last time we were super pumped. We had just got our primary sponsor to agree to work with us to introduce the bill, and she was super hopeful on getting a co from the other side of the aisle, but her co has backed out and doesn't want to introduce any new legislation in the upcoming session. So we are kind of back on the hunt for a new co-sponsor. But our primary sponsor is still really excited to kind of take it forward. Her original plan was for us to introduce, they have 2 more sessions or 2 more days of sessions in November and then 1 in December. And she wanted to just put it on the floor to be heard, like the name of it get heard and like the concept, knowing it wouldn't get referred this year and then kind of reintroduced with a full year to go next year. Without a co, I don't know if it's getting put on the floor yet this year, but the goal is still early 2024.
Okay, great. Thank you for that update. And if there are anyone on the call that has connections within Ohio, I'm sure, you know, offering those to Kaylee and the group would be great. All right, we've got Randy in Pennsylvania.
Okay, hey, thank you. Just give you an update here. It's to let everybody know, Pops is going to be celebrating their 52nd annual meeting this year at the Hershey Country Club. So that's a milestone to think of. Many years ago, my previous employer was very active in POPs, and so are some of the other members of POPs still in here. It's great to see an organization still be around 52 years later, on the state side here, working on issues related to those patient care issues and those issues that affect us. But anyway, so to give you an update, we're updated the POPs website to include all the so everybody can move information, and it looks really good. We're at our POPs meeting here on Monday. We're going to actually there's going to be a lot of discussion moving forward to get everybody involved, so I'm looking forward to that. So are the others in the core team. Also, as far as within PA Medicaid, we found out that I was having issues with them before and trying to discuss fee schedules and everything else. And there's new individuals in place, and now supposedly there might be a possibility of updating, PA Medicaid to be more reasonable. So we're trying to we're forming our bill around that to be inclusive, but maybe maybe it won't even need to be something we'll have to worry about in the end. So we're confirming that right now. And Yesenia, our lobbyist, is working very diligently with us. Even though on our side we don't need to have study for insurance for the Insurance Commission. It's basically legislators still like to see that. So we're still going to work on putting that together, and we're pulling some of that information together. But all in all, I think all is good. The House and Senate here in Pennsylvania has really been dysfunctional this year, pretty much. It's I think they only, up until just recently, had only out of 70 bills, they only passed 7 bills. So it just, because of seats being up for grab, weren't finally settled until the 28th of September. So now they added 3 more days in December. So we have 12 days here in November and 12 days in, 6 days in November and 6 days in December, which is unusual to have 6 days in December, coming after the elections here. That'll be coming up here, the local elections and stuff here next week. But we're looking forward to working with you through the process, and thank you very much for the support in supporting POPs in this venue. We do have been talking to some other individuals in DHHS with clarification, and we're starting to get feedback, so it's good.
Awesome. Thank you so much, Randy, for that update for Pennsylvania as well. We're excited for you guys to move forward for 2024. All right, the last state we have on our list, at least for 2024 groups, is David from Tennessee. Is David still on?
I am. Yeah, we're still here. I'm
all right. Thanks, David.
You probably have the same experience growing up, being, your last name being the alphabet, so you're used to waiting, right?
Yeah, that's where I built my patience.
No, Tennessee's doing well. We actually, this past week, we were in Johnson City at East Tennessee State University, which is rolling out their new prosthetic and orthotic program, their master's program. And so we met with the new director, and we met with some of the deans, and we had the opportunity to briefly, we ate lunch and had a conversation about what we're trying to do legislatively. And the university has a whole department that focuses purely on legislation. So we found a new ally, and so we're excited about that. We are finally at the point where we're employing a lobbyist. So we have Ryan Peebles coming on board as our lobbyist, and using the energy that he's done previously for the bills that were previously introduced. So we're really hopeful that we'll have a lot of movement in the next 30 days. We have lots of support already from legislators, and so we're just pulling everybody together at this point.
Fantastic. That's great to hear, and that you guys are engaging Ryan as a lobbyist too. I know that he's been part of it in the past and will have kind of that historical knowledge to help.
Yep, absolutely. There's been a lot of phone calls back and forth, and getting multiple governing bodies involved to move things forward and check some legalities on different things and make sure that everybody's in line with where they need to be, and so everybody's comfortable. The Tennessee Society of Orthotics and Prosthetics is technically going to be the face of it all. As far as the lobbying aspect of it goes, we'll run everything through that, and we're going to start fundraising. Joseph, my counterpart that's usually on the call, he's flying today. He'll be spearheading all the fundraising efforts. So we're really hopeful in the next 30 days we'll have made a lot of headway.
Awesome. Well, we're excited for your update at our next call. So good luck in the process. I know we're at time. Two housekeeping things I wanted to share. One, we've kind of perpetually been going over time on these meetings, and so moving forward, we're going to consider expanding the time on this a little bit so that we're making sure people can schedule for that. The other thing is that we now have 28 states that we're currently working with on this, and so we want to figure out a good structure to give everyone time to update, while also making sure that the call doesn't go for 5 hours long type of thing. So we're definitely open to feedback from all of you on, if there's certain things that you would like to see out of these calls. We might do a poll of everyone to kind of figure out if there's certain information you would rather have shared or a different way that you would like these structured. We're definitely open to, changing things as we continue on and as the initiative evolves. So just wanted to say that, that we're working on that. And then for anyone who needs to jump off and leave, we are at time, but if there are other states that are, not necessarily going to have legislation for 2024, but want to give an update or share or get any kind of feedback or questions, would love to hear that from you at this time. And maybe we can stay on for another about 10 minutes and then we'll have to jump off.
Nicole, it's Kimberly Hansen.
Yeah,
I can speak around Texas.
Amazing.
So I know Sam said on our call this week, we are having monthly calls and we are putting together a coalition. So we're at the very beginning of the process. But yesterday, we've had 3 calls so far. Yesterday's call, which Rob Bertram and Mark are leading through the coalition. We met with the lobbyists yesterday and we are waiting for a letter of engagement on that. Our group needs to, and Catherine Mize just joined the group yesterday. And we're really we need to put our structure together on who's going to help fundraise, who's going to help do certain activities around it. And I'm really hoping by the next call for Texas that we will have a lot of progress over the next 4 weeks. Our goal is to, Texas won't meet till 2025. Our goal is to have a bill introduced by November 2024. And we are working with Snapper, the lobbyist. He knows sort of the track that we need to do. He's worked with us before. Mac McClellan and a few others on the Texas Coalition have worked with him on putting together 4 bills through. 3 were approved. So they've had a pretty great success rate. So I'm looking forward to what comes in the next really 60 days. Because we hope to engage him by mid-January to start the work.
Oh, that's fantastic. With your legislation, I know you guys are still chatting with the lobbyists, but that's going to include an element with the So Everybody Can Move physical activity component in addition to some other provisions.
Yep, exactly. So Texas currently doesn't Texas Medicaid does not allow for orthotics or prosthetics for patients over the age of 20. So it was interesting. I love the format of this call. That will be my feedback because Maggie, I might actually reach out to you when you're talking about sacrificing O versus P. It gave me a great idea on our fiscal report that we should actually find out what the O is driving for the budget concern versus the P. Because I could see us sacrificing something. So we're going to have the O and P for adults over the age of 21. We're going to introduce the bill for cranial because cranial currently isn't covered. And then activity and sports prostheses, as well as the showering needs. because I'm actually a resident of Minnesota, but I'm on this coalition because Ottobock is based in Texas. So they needed some, I knew Texas was in good hands. Sorry, Minnesota was in good hands. So I jumped on Texas. So yeah, so we're going to have a sort of an umbrella, but we're going to have three segments of that bill. We had already discussed that and our lobbyists agreed that's a great way to position it. So, but I do feel like we're going to be compromising because we are asking for a huge budget ding to the Texas state budget by asking for O&P for over 20.
Absolutely. Thank you for that update. That's amazing. And just seeing how you guys are re-envisioning the kind of model legislation too, in terms of what you're including on that. I think everything's bigger in Texas, right? That's the saying. So that holds strong for your legislation as well. So we're excited to keep in touch on that and officially add Texas to the map. That'll be great.
Perfect. Yeah, thank you.
Just a quick update for Georgia. Rachel and I we've designated ourselves as the leads, and then we are at the beginning of collecting the team and designating like each person to start the process. So the ball's rolling in Georgia, so we're looking forward to hopefully, definitely getting into it next year.
Awesome.
And we're also starting the monthly calls in the state as well.
Fantastic.
Yes, I wanted to just jump on and ask a quick question though regarding with Texas and some of the other things. Has anyone had success including a parity law in their legislation? So in Georgia, we have something that where some payers do not allow like a certain amount of money, and so for any device, and so we didn't know if that was something that had been included.
Yeah,
so I can speak to Texas.
Go ahead, Kimberly.
Texas has a parity law. And so one of our strategies might be to open up the parity law to add in additional language to allow for primarily around the access, the non-discriminatory practice, and hopefully try to get the cranial in there. But we're going to rely on our legislative author and our lobbyists to help figure out what is the best path for that. Because we actually asked the question yesterday during our lobbyist call, and it's really has to be tailored specifically to how the language is in your state, but it's not off the table by any means.
Okay. Thank you.
I would just add to that the model legislation that we have does include insurance fairness as part of it. And so for states that have been able to enact this legislation already, the 5 states, the majority of them already had insurance fairness bills on the books from kind of the past 2 decades that insurance fairness has been done. But we do have states for this upcoming session, Minnesota being one of them, that does not yet have insurance fairness, but is including that in their bill in addition to the So Everybody Can Move physical activity component.
And I noticed researching the Arkansas bill that they put in a K level. Is that something that you guys would recommend as well?
I would have to take that back to the team for specific guidance on that, but okay, I'm seeing Ashley shaking her head. I would love to hand the mic to you, Ashley, on that.
Yeah, I'll just share that. I think when you start to put technical language into any legal document that is going to govern whether it's a regulation or legislation, you quickly get yourself into a situation where that is like, no matter what happens with K-levels in the future, the law now includes something that could change, that could have movement. And so what you want to create and what the recommendation for the model legislation is designed to make sure that it's encompassing of as many legislative dynamics in the individual states, but it doesn't codify something that could be restrictive down the road. So you also a lot of times people will say, well, the person that's most appropriate to designate X is this, and so we want to put them in our bill. But then you have to say, well, are all physicians aren't created equally, and all, you know what I mean? So I think you want to try to think about it through the lens of that the language can be restrictive. It can also be used to be restrictive. So just a note there.
That also
No,
kind of
thank you.
Jennifer from North Carolina, that kind of reminds me of the whole like K2 for microprocessor need limitation. You know, the people who need it most sometimes are those people who are lower activity, that especially when you're talking about exercise, people that have the potential to increase in their activity level. So I agree with Ashley on that. They'll use it against us. But I just from North Carolina, we just recently met with Medicaid to get our rates increased. Dana Glover, Del Bianco, Sean Zeller, a bunch of folks met with Medicaid, and we're also going to be tackling the new Blue Cross Blue Shield limitation that just came out for Blue Cross Blue Shield of North Carolina, which limits a device to 1 every 5 years. And that's brand new. That's something that just came out, and people are actually not having a lot of success appealing it. So that's a big thing on our table, and also changing the SNF coverage laws for Medicaid when a patient's in a SNF. So we're trying to get that changed as well.
Thank you for sharing that information, Jen. Definitely, those are important ones to tackling for broader kind of OMP coverage as well. Awesome. I know we've got a few minutes here left. We'll kind of end the call at 2:15, but is there anything else that anyone wanted to ask or share?
I just wanted to shout out to the Academy, because in the president's message, he actually put in "so everyone can move" was part of the Academy, which is really nice.
Oh, that's great. Thank you.
Yeah.
Thank you, Colleen. And yes, absolutely. We're very happy to have partnership for So Everybody Can Move with AOPA, the Amputee Coalition, the Academy, and the National Association for the Advancement of Orthotics and Prosthetics. Wanted to note in the chat too, Ryan Getty from the Amputee Coalition is in Texas. So Kimberly would love to get, Ryan connected with you all. And I think Sam offered to connect Lisa and Ryan to that. So just wanted to note that we are, I guess as a benefit of remote working, that we are covered in many different states. Awesome. Anything else from individuals? Awesome. Thank you guys so much for being on this call, and we're looking forward to our December meeting. So we will send out more information from this call in terms of next steps, getting information from you all on the website. And then our next call will be on Friday, December 8th at 1 p.m. Eastern time. And we'll send out the recording and notes from this as well. Thanks, everyone. Great to see you on this Friday, and hope you have a great weekend.